Hi, my name is Kaylin. I'm an intern biokineticist at the University of Johannesburg, and we are doing ECG placements and assessments. So usually we'd get the patient to lie supine on a flat surface. Usually we get them to relax as much as possible, and then we'll start with the placements. The placements they look like this. They are very cold on the skin, so as you place them on the skin, they're very cold, so you would want to warn your patient about that. Before you do that, you have to basically alcohol swab the surface just in case there's any cream or anything that might not let the placement stick. So you would just swab where the placements would be going, just in case. Good. Okay, so the first placement goes on the right side, midway between the clavicle, just underneath, so subclavian to the right side. The second placement goes on the left side, midway between the clavian, sub, which is just underneath the clavicle. The next two placements are just above the ASIS on the right, so you would just palpate for the ASIS, and just above that. The fourth placement will be the same on the left side, just above the ASIS. So you just palpate and you just place it above. So these would be the placements that are usually you'll see on the ECG. That's looking at the different aspects of the heart. So the first placement, which is called V1, is in the fourth intercostal space, right of the sternum. So what you want to do is you palpate. You start right under the clavicle, which will be intercostal space number 1. You then feel for the rib, and you feel for the next intercostal space, which will be 2. You then feel for the second rib. The next space will be 3. You feel for the fourth rib, and the next space will be the fourth intercostal space, which you place V1 right of the sternum in the fourth intercostal space. V2 would be the same on the left side. So you palpate for the intercostal spaces. So that would be 1, 2, 4th intercostal space, left of the sternum. That's V2. Now what we usually do is we place V4 before we place V3, because V4 will be in the 5th intercostal space, midway, so you measure from the clavicle to the acromion process, midway, all the way down, so it should be right underneath the nipple. And that would be the 5th intercostal space. That's V4. V3 is usually in line, in between V2 and V4, also on the 5th intercostal space, in line with the 5th intercostal space. V6, you usually place V6 before V5. V6 is mid-axillary on the 6th intercostal space. So if this is the 5th intercostal space, you want to place V6 on the 5th intercostal space. V5 goes between V4 and V6 in line with the 5th intercostal space. So the lead should usually prompt you where to put the leads on which placement. So this one says L, which is left arm. If it does give you a bit of a hassle, you just pull the lead apart and you clip them on, because sometimes they're a bit hard to clip on. The one says left leg, so you put it on the left leg, which is the lead above ASIS on the left, and then N is for neutral. So the right side is always neutral, the right hip placement. And then you place these leads as you placed the placements. So V1, you'll place on V1, which is 4th intercostal space on the right of the sternum. V2, you'd place on V2 placement, which is left intercostal space, the left of the sternum. V3 is between V4 and V2, which is in line with the 5th intercostal space. V4 is 5th intercostal space. V5 is in line with 6th intercostal space, and V6 is mid-axillary 5th intercostal space. We then click the ECG button on the computer and it will load the ECG. So usually it will be fine, but it will say, sometimes it will give you like a bad signal on V5 or V6, and then you'll just check in case sometimes the patient's shirt will be on and then that interference of the shirt might give it a bad signal. And then also the ones by the hips, especially because of the pants. So you just give it a few seconds to normalize. So as you can see, the ECG looks pretty normal. Those are the waves you want to be seeing. The first small wave is called a P wave, and a P wave is atrial depolarization. The next complex is usually the QRS wave, which is the one that goes down, up and down. So it's usually the biggest wave in the ECG, and that is ventricular depolarization. The last wave, which is the T wave, is usually ventricular repolarization. So that's the ventricle coming back to normal. Usually with the ECG, we're looking at rate and rhythm. So usually the rhythm is to see if we usually calculate rhythm from QRS complex to QRS complex. So it's usually from that point to the next point to the next point to see if the rhythm is exactly the same in each complex. For heart rate, when you calculate heart rate on an ECG, there's usually big blocks, as you can see, and then there's smaller blocks inside the big blocks. But the big blocks is how we usually calculate heart rate. You take 6 big blocks, or however many blocks you want to count, so it's between the QRS complex to the next QRS complex. So you count those boxes. So for instance, let's say it's 1, 2, 3, 4, 5, 6 blocks to the next QRS complex. You then divide that by 300, which will give you the heart rate then. So 300 divided by how many blocks are between each QRS complex, and that should give you your heart rate. So what we want to see is a normal P wave. a normal QRS complex, and a normal T wave. Usually if there are many P waves and not a lot of QRS complexes, it shows atrial fibrillation. So a lot of P waves and not so many QRS complexes. Then a lot of QRX complexes and not a lot of P waves is ventricular hypertrophy. So you'll see a lot of QRS complexes. For the ST segment, so it's from the S portion, which is this lower portion, to the T wave, which is that, you want to see almost like a normal wave. So if it's too high, which is an elevation, or too low, then we know that there is some issues along the ST segment. So with the ST segment, if you see any depression of the ST segment, it might indicate some pathology of the heart, usually ischemia. If the ST segment is elevated, obviously we're talking abnormally, you will then think that there is some pathology with the heart as well, of the muscle, usually myocardial infarction. So that is complete block of blood supply to the heart muscle. And as you can see, they're all fine. Like it doesn't say there's no signal here, 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 here. So if you've placed them correctly, then they should give a normal reading like that.